Hello and welcome to this video on the most common types of wrist fractures. In this video, we will discuss three types of wrist fractures: distal radius fractures, scaphoid fractures, and dorsal triquetral avulsion fractures. We will cover their presentation, diagnostic tests, and treatments. Let's start with distal radius fractures. The distal radius is the most commonly fractured bone in the wrist. The presentation of a distal radius fracture includes pain, swelling, and difficulty moving the wrist. In some cases, the wrist may appear deformed. To diagnose a distal radius fracture, your orthopedic doctor will perform a physical exam and order an X-ray. Treatment options for distal radius fractures include immobilization with a cast or splint, or surgery if the fracture is severe. Following fracture healing, your doctor may prescribe hand therapy to improve your motion. Next, we have scaphoid fractures. The scaphoid is a small bone located near the base of the thumb. Scaphoid fractures typically occur from a fall on an outstretched hand. The presentation of a scaphoid fracture includes pain and tenderness in the wrist, especially in the area of the scaphoid bone. Swelling may also be present. Diagnosing a scaphoid fracture can be challenging, as X-rays may not show the fracture immediately after the injury. If a scaphoid fracture is suspected, your orthopedic doctor may order additional imaging such as an MRI or CT scan. Treatment options for scaphoid fractures include immobilization with a cast or splint, or surgery if the fracture is severe or not healing properly. Lastly, we have dorsal triquetral avulsion fractures. These fractures occur when a ligament attached to the triquetral bone in the wrist pulls a small piece of bone away from the main bone. This type of fracture typically occurs from a fall on an outstretched hand. The presentation of a dorsal triquetral avulsion fracture includes pain and swelling on the back of the wrist, just below the base of the hand. The area may also be tender to the touch. X-rays can usually diagnose a dorsal triquetral avulsion fracture. Treatment options for dorsal triquetral avulsion fractures include immobilization with a cast or splint. Surgery is rarely ever necessary. In conclusion, wrist fractures are a common injury, and three types of fractures we covered in this video are distal radius fractures, scaphoid fractures, and dorsal triquetral avulsion fractures. If you suspect you have a wrist fracture, seek medical attention promptly. Remember, early diagnosis and treatment can lead to better outcomes and faster recovery.